How to recognize a stroke early that everyone needs to know. Visual signs. A stroke often affects the patient's vision, causing blurred vision in one or both eyes, reduced vision, etc. Dizziness and loss of balance. One of the warning signs of an impending stroke a week in advance that you need to remember is loss of balance and dizziness. People with strokes often have signs of loss of balance such as dizziness, difficulty maintaining balance as usual, difficulty walking, feeling nauseous or wanting to fall, temporary memory loss, because blood flow to the parts of the brain responsible for memory is reduced. This causes the following conditions: forgetting recent events or important information, difficulty remembering the names of acquaintances or places, feeling confused and uncertain about time and place, feeling tired and lacking vitality for a long time can be a warning sign of a stroke because the brain does not receive enough oxygen and nutrients. At that time, the patient will experience constant fatigue without being able to explain the reason, pale skin, lack of energy and no motivation to work, frequent drowsiness, poor concentration. Facial signs. Facial signs are one of the earliest and most characteristic signs of a stroke. Observing the patient's face, you will see signs of asymmetry. The philtrum is slightly tilted to one side. The mouth is crooked. The nasolabial fold on the weak side is drooping. Especially when the patient smiles or talks, the mouth and face will be clearly asymmetrical. This is a consequence of brain damage caused by a stroke. Signs in the voice. Symptoms in the voice may appear as unusual slurred speech, difficulty speaking, difficulty opening the mouth, stiff lips and tongue, eczema, making it very difficult for the patient to pronounce. Signs of weak arms or legs. Weak arms or legs due to stroke often occur on one side of the body. The feeling of sudden weakness and numbness is very clear. If the stroke causes damage to the right brain area, the left arm and leg of the body will be affected, and vice versa. You can check your ability to move your arms and legs by spread your arms out wide for 10 seconds. If you cannot control one arm and it falls down, it is highly likely that this is muscle weakness, a sign of stroke. Cognitive signs. Damaged brain cells will directly affect cognition. Signs of recognition such as memory disorders, tinnitus, loss of awareness, neurological signs. Severe headache is the most obvious symptom, the earliest appearance of a stroke. The pain can make the patient unable to stand. Nausea, vomiting. Stroke patients may experience a number of other problems depending on the damaged brain area, such as sudden dizziness, weakness on one side of the facial muscles, severe headache, rapid heartbeat, difficulty breathing. When a person has the above symptoms, they are likely to have had a stroke. So call an ambulance immediately or take the patient to the nearest hospital. The sooner the patient is taken to the hospital, the less damage, the higher the chance of recovery. Note: place the patient in a lying position with the head elevated 30 and 45 degrees to keep the airway clear and avoid the risk of suffocation. Keep the patient in a quiet space, and if the patient falls, please do not try to move them. Dress the patient in cool, loose clothing or loosen their clothing. In case the patient has a seizure, use a chopstick wrapped in a cloth placed across the mouth to avoid biting the tongue. Observe to fully remember the symptoms. Provide this information to the medical staff performing emergency treatment when they arrive.